questions focused on Helicobacter pylori, a gram-negative curved rod that produces urease. Question 1, pathogenesis and clinical presentation. A 45-year-old man presents with epigastric pain that improves with eating. He has had these symptoms intermittently for several months. He denies weight loss or melena. Physical exam is unremarkable. A urea breath test is positive. Endoscopy confirms a duodenal ulcer. Which of the following best explains the role of the causative organism in this patient's disease? A. Toxin-mediated inactivation of p53. B. Production of enterotoxin that activates G. C. Production of urease that neutralizes gastric acid. D. Secretion of proteases that inhibit IgA. E. Invasion of intestinal mucosa and destruction of villi. Correct answer C. Production of urease that neutralizes gastric acid. Explanation. Helicobacter pylori colonizes the gastric mucosa by producing urease, which breaks down urea into ammonia pH locally, enables survival in acidic stomach and damages mucosa, leads to duodenal ulcers, often with relief upon eating, protective secretions. Why not? AP53 inactivation is related to gastric cancer but not duodenal ulcers. B. Cholera toxin or heat label enterotoxin mechanism. D. Seen in Giardia lamblia. E. Characteristic of Shigella or E. hesse, not H. pylori. Treatment, triple therapy, PPI plus clarithromycin plus amoxicillin or metronidazole. Question 2, diagnosis and associations. A 60-year-old woman is evaluated for persistent upper abdominal pain, early satiety, and nausea. Biopsy during endoscopy reveals intestinal metaplasia and chronic gastritis in the antrum. Testing is positive for a gram-negative, spiral-shaped rod that produces urease. Which of the following conditions is most strongly associated with this infection? A. Barrett esophagus. B. Peptic ulcer of the jejunum. C. Gastric adenocarcinoma. D. Celiac disease. E. Acute pancreatitis. C. Gastric adenocarcinoma. Explanation: H. pylori, chronic gastritis, intestinal metaplasia, increased risk of gastric adenocarcinoma, and malt lymphoma. Biopsy and urease tests confirm diagnosis. Why not? A. Associated with GERD, not H. pylori. B. Peptic ulcers from H. pylori typically affect duodenum, not jejunum. D. Autoimmune, HLA, DQ2, DQ8 related. E. Not related to H. pylori infection. Would you like similar